which is all about systems and sustainability. But I didn't kind of make that connection at the time, and I just thought, I just kind of looked it up in the dictionary, and I thought, what are we talking about here? And so it's just the quality of being able to continue over a period of time, but that doesn't give us much guidance in terms of what we do. So slide number 3, please, Jill.
Okay.
So I did it again, waited for my screen to change. So I've been, after these many years, I've really, just this summer, been digging into the literature. And I'm going to talk about a particular book. And I excerpted this quote from the book, and I'm going to tell you more about the book in a minute. And I thought this quote was really important. So this book is called The Fifth Discipline. And in it, they talk about actually learning communities, but learning communities for a purpose around systems and sustaining strong systems. So this quote is from somebody from the National Health Service in Great Britain. The book itself includes real-life examples from big, strong organizations like Fortune 500 companies, big nonprofits like Oxfam, who have all used this method. So here's what this leader from National Health Service in the UK said. And the National Health Service is their like Medicare for all kind of program in the UK. So I reflected a lot on this when I worked with NHS. I would watch managers fix immediate problems like waiting list targets by not attending to anything else. But if you've done nothing to fundamentally change how the whole system is working, once you take your eye off of it, the problem comes back. If you take the time to figure out with people how you can get a system that is going to continue delivering better results, it takes a lot longer, but when you've got it, it doesn't walk away from you. It may take me a bit longer to get there, but when I get there, I know what I've got is more sustainable. And one of the things that stood out for me is the figure out with people, and that's the planning that you're doing, sustainability planning, but all those relationships that come before that get you to the point where you can actually engage people in planning. And then the other thing that stood out for me is that you continue delivering better results, because sometimes we, especially with short-term funding, we have these wonderful programs and they just don't last over time, or they don't figure in change as part of sustainability. I mean, one of the things the book talks about is sustaining change, being able to roll with changes. And then the last thing that stood out for me is that it takes a lot longer. So we tend to do our planning when we're writing grants, and we get a small group of people together, and we put in our logic model and our goals, and then that's sort of set aside. And just reading the reports from the states, I noticed that some states are better than others at monitoring what's going on, fessing up to like what's not working, and making adaptive changes as they go, which actually strengthen the program. So I thought this was important to think about. And in the fourth slide, Jill, so this is the copy of the book. So this man who wrote the book, Peter Senge, is at MIT. He's a really smart guy. And when I was still teaching at University of Washington, he was quoted by so many of the doctoral students I supervised in the research class I taught. But I've come to him late. But this last week I was meeting with Kim Whitmore, the excellent Kim Whitmore, and she talked about how important this book was to her at the beginning of her doctoral program. So I'm digging into this book for you, but for any of you who want to dig deeper on your own in terms of leadership and strengthening the groups that you work with, I recommend this book. It's really, really good. But I'll be bringing things from it to you that I think will support the work that you're doing. So it's by no means required, but it's good. Okay, the fifth slide, please. So let's talk about systems for a minute. They are defined as parts that comprise a coherent whole. So the coherent part is really important. And they're sustainable when they are thoughtfully organized so that each part is not only interdependent. This is what the book says, that they're interdependent. But I added this, but they're supportive of the whole. And I added that because that's been my experience being educated in a university center for excellence in development of disabilities, and also being an associate director of one. I've really seen this in my own life, and it's made a big difference in my own life, in my growth and my professional growth. And then systems are both a framework for your mental models, and a logic model is an example of a mental model recorded on paper. But it's your own individual mental models are probably much bigger than a logic model is on paper. You probably have a grand vision of what you want to accomplish in your states in terms of respite systems. And when I was in graduate school, one of the games we played is If I Were Queen. And that's like if money were not an issue, what would the system look like in your state? What would you really like to see? That's your mental framework. And in addition to the mental framework, and this group really knows as well, systems are dynamic, relational, human enterprise. And we see this firsthand in this group, in those of you who have team members who actually come to this meeting or who go back and share the information and work collaboratively.
I think we may have lost Susan on a key point. Susan, we cannot hear you. I don't know if you can hear us. Has anyone else read that book that Susan was talking about? No, me either.
I've heard about it though. It's on the list.
Let me text her. Let her know that we can't hear her. It's that darn full moon. Well, while we're waiting, we could do, I know your time is very precious. If you'd like to go around and maybe do your updates now, that would be wonderful. Until Susan can get back with us. Who wants to start? Anybody?
I can start.
Okay, great, Brooke, go ahead.
Well, as you know, Jill, we are working with the pilot project out of Iowa or Ohio. I can't remember now off the top of my head. To recruit and get respite providers up on our website. I think I told this group and some of you in this group about our own efforts locally in Montana to try to do that exact same thing. So we decided to partner with people who are studying that, and hopefully we'll get more people up on that website. So hopefully we can sustain the payments and the funding into Lifespan Respite. But even if we're not able to do that through federal and state dollars, the website will help sustain the respite systems, because people, if they can pay for it themselves, will still be able to access those respite providers. So that's what we're really excited about now.
That's what, okay. I'm sorry, I was texting Susan still at the very beginning. Who are you partnering with, did you say?
We were just on that call. Is it
with Arch, and you've decided to move ahead?
Yep. Mm-hmm.
Oh, excellent.
Yep.
Oh, I'm so glad to hear that. Okay.
Yeah, we're really excited about it.
We'll be announcing the final states by October the 1st, but at this point, if you apply, you're in unofficially.
I just
You're all
trying
such
to,
fantastic, could be fantastic partners in this project, all of you.
yeah, I'm excited. I was trying to project positivity.
Yeah.
You know, if you put it out there that you're participating, then you're more likely to, I guess. Thanks.
Anybody else want to share an update?
I will, Jill. It's
Okay.
Marilyn.
Great.
And I haven't been with this group for a while. And I just want to say I really appreciated the sustainability, focusing on this slide that's up, that because when I think of sustainability, I think it's structure. And so it's helpful to me to understand that there's agility and structure, which is what I see in that second bullet. And for us, we've kind of set aside structure in terms of being agile to take advantage of opportunities when they present themselves. So we just got off a 3-day conference with the Commission on Aging and this will sound familiar to Dina because she and I have talked about this, about how we can embed our Family Caregiver Navigator project in the adult protection system in Idaho. And I think the commission, it's still very much in the works, but the Commission on Aging, I think we'll be looking at a 3-year pilot and contracting with our Navigator project or the ICA to do kind of an early intervention in the APS process. So we'll just, that's one thing we're working on. Our Family Caregiver Navigator project is the elephant in the room for us. I mean, it's taking all of our effort and time, and we're just entered our 2nd year of that, of providing very individualized resource and referral, kind of like options counseling and INA combined with a real individualized approach for family caregivers. We've touched over 300 family caregivers in our 1st year. We're using T-Care. We got that from Washington State, and I know that Dana's using that in New York as well. But that's what allowed us to have this partnership with adult protection. We're continuing to talk with Medicaid about squeezing out a 3rd year of funding for this 2-year demonstration. And we've, in this 2nd year, we have some money from one of our healthcare systems who's paying part of the staff time for our lead Hispanic, lead bilingual navigator. And the other, and that navigator is a employee of the local area agency on aging. So it's a really nice partnership to provide that navigation service in Southwest Idaho. We've got, I think, 4 navigators and then a kind of a navigator intake person. But in terms of sustainability, we're also contracting with a woman out of Portland to do help us develop a business plan to market our Navigator project, but it will also be useful in kind of marketing and pitching our ICA, our Idaho Caregiver Alliance. So we'll have something with that around the 1st of the year. They're doing some interviews of some of our partners to kind of get a little deeper, richer picture of how they see this model fitting into systems in Idaho. And we have applied for a grant from the Blue Cross of Idaho Foundation to do a developmental evaluation of the model. So we're doing a lot of our things are focused around the Family Caregiver Navigator project because it's so, it's time limited, but it's very visible, it's very tangible, and it is something that makes it easier for us to talk to folks about in terms of what we're doing. We continue to do newsletters, quarterly meetings, an annual conference, but this has been a really wonderful kind of capstone project for us. And we've also been very involved with a variety of other partners around the issue of the shortage of direct care staff in our state and what the impact has been on families during COVID. And so there are a bunch of work groups working on that, and we expect that there'll be perhaps some action in the legislature around that, but we're part of a much larger coalition dealing with that. So that's just some of the things we've been up to, Jill. And Dina, I will keep you posted.
That's some incredible work that you're doing there, Marilyn. Really incredible. And I'm especially intrigued by your partnership with Adult Protective Services. I think that's a wonderful partnership that not too many states in our Lifespan network have explored, as far as I know. There may be more of you who have done that I'm not familiar with those partnerships, but I think it's really critical.
Well, we have a great leader of our Commission on Aging. She's been there 4 years, and she, with all this federal money that's come in,
Right.
That's allowed her to kind of step back, look at our APS system and say, this needs work.
Yeah, that's awesome.
Thank
And
you.
I also love, I hope at some point, just to throw this out now, that as you engage this consultant on your business plan, that maybe at some point you'll be able to share that whole process and
Sure.
even the tools
Absolutely.
with this group. I think that would be really wonderful.
Will
So
do.
Jill-
Talk about another.
Jill, I'm on
sustainability
now.
plan
Can you
too.
hear me?
Oh, yeah, great.
I'm actually on the computer, and I'm so sorry, everyone. Hey, Marilyn, I came in the middle of yours, and it sounds amazing. And one of the things I just wanted to point out that Marilyn's doing to the group. So with the navigator and sustainability, they're interviewing people. They're collecting data to support and guide what they're doing. So that's really, really important when you're building systems. I love that you're focusing on the shortage of direct care staff, like knowing what's going on in your own state around that. That's really, really important. And then I wanted to hear about the business plan. I think you talked about it before I was on. What made you know that you were ready? Like, why now?
Well, I think this Navigator project is only a 2-year project. And so we had to act quickly. And for this second year, our focus was on sustainability and outreach into the Hispanic communities of Southwest Idaho. So we're doing both of those kind of together. And so it was, I think probably it was our Sarah Taves, who directs our Center for the Study of Aging, and the rest of our team. We just thought we needed something that, if we wanted to continue this project, we needed something that we could pitch.
Yeah.
And we're really good at kind of getting in and doing this work, but we're not always looking at things from a business model package perspective. And so that's why we are going this direction. And we think that while it's focused on the Navigator project, it'll be of value to the ICA in terms of how we can position ourselves to take advantage of funding opportunities and other opportunities as they come along.
Yeah, that's fantastic. And you've got the long view. That's really wonderful. Okay, what else did I miss when I was in the Netherlands?
I just want to say hi.
Why don't we keep progressing with who would like to go next? So
Okay.
we give everybody a chance to do an update. I think that would be nice.
This is Dina. It looks like, is that Doris that just joined, just from the area code? I'm wondering if it's her.
Oh,
It
yeah.
is.
Okay. I had a feeling. I was like, oh, I think that's Doris. So I don't mind taking the lead, but Doris, please chime in. I think one of the exciting announcements we want to make as part of sustainability is Doris and I were successful in advocating for Lifespan of Greater Rochester, where our coalition is housed, of them taking on administering our voucher model that is being implemented this year. So that was a success in our book, thinking about it from sustainability. So really super excited that they are agreeable to giving it a try. I don't know if you want to add anything, Doris, to that point.
Sure. Holy cow. It's a big lift. It is a big lift, but we're excited about doing it. We've hired a program coordinator who's working real hard to get all our forms and everything together. Shout out to Wisconsin. They've been really helpful in letting us use some of their stuff as a model. We love working with them. And yeah. And on top of that, we have our final sustainability summit on October 8th.
Right.
We are fortunate to have Jill joining us, and we're focusing on really developing an advocacy piece in the coalition. We feel like it's a piece that's been missing, and we're really excited to be doing it. So that should round out our sustainability plan. It should all be on paper in the near future.
Can I ask a quick question about the voucher piece? When you
Sure.
say the Lifespan agency is taking it on, that's the agency and not the coalition through the Lifespan
No, it's
grant.
right. It's through the Lifespan grant. The coalition is taking it on, and the agency is supporting us.
Oh, I see. Great. So you'll be
Yeah.
offering vouchers statewide?
We'll be offering vouchers statewide. To start, we're offering $100,000 under the just for kinship caregivers. We're really putting a big focus on that, and then we'll have $50,000 from Lifespan Respite under the enhancement grant for all other caregivers who aren't served under Medicaid.
Wow.
But
Awesome.
that's just year one for the 50,000. So the way we structured our new 5-year grant, which I'm not sure if we shared this in the last call, but we are piloting a caregiver wellness and respite center in the North Country region, a 6-county region. And so we did build in a year of development, but so they're going to become operational July 1st of 2022. And so we did require that 40% of the funding they receive will have to be for respite services, which could be a combination of offering vouchers and potentially some contracted providers as well. So the 50,000 is just really slotted for year one of vouchers. Since we're going to be developing the Caregiver Wellness and Respite Center, we wanted to still be able to offer some respite during year one. And then the kinship vouchers is under our 3-year grant, which we're in year 2 of.
Yeah. And on top of that, we're in the process of writing a grant to the New York State Health Foundation for the development of the voucher model. So we feel it's really timely and have our fingers crossed that we'll be invited to do a full proposal. But in light of sustainability, we keep going for more funds.
Excellent.
And I think just the other pieces I can think of for sustainability. I mean, yes, we have the summit coming up, which is great. I think we spoke of this last time, Jill, that we're doing the Life Course Respite tool that will be having all of our New York Connects, which is our no wrong door ADRC in New York State, all of the credentialed person-centered counselors under New York Connects will have this tool added as part of their toolbox. So that is going to involve us having to add the tool electronically into their system for accessing it when they're working with caregivers. So we have a plan. We kind of have a cross team, for training and coming up with a plan for the actual training to occur in years 3 through 5. So in the final 2 years of the grant. So we're excited about that. So that'll be something that they'll have in their toolkit, for future use. And as new counselors come on board, then we'll be sure that they get the training as well. So we're still doing some work around that and how it will look for the rollout. I feel like there was one other thing that I felt like for sustainability that we had going on. Abby, she's always good about being my brain sometimes. Do you know what I'm trying to think of?
I was just thinking about the caregiver simulation manual. I don't know if Doris, if you want to talk a little bit about that.
Sure, we've manualized the whole caregiver simulation so that people could just take it and use it to do it in their own communities. We may put a train the trainer kind of around it once COVID brings some relief, or we get some relief from COVID. But we did spend the year that we were kind of battened down. Sharon put that whole manual together, so it's really exciting. So we'll be sharing that in the near future as well.
That was a good one. What I was thinking of was we're actually still, because I think we reported to this group that we're doing we had launched a work group in January for expanding our caregiver directed model under the National Family Caregiver Support Program. For any new folks, I had shared that we invited the coalition NYSERC to take part in those work group meetings because we felt it was important that ever we landed on this expanded model, that it could work under kind of both program areas, so that if Lifespan Respite dollars were not necessarily available and these kinship programs needed more funding for respite, that they could easily then tap into our AAAs and accessing respite dollars for these kinship caregivers. So we finished up our final work group with our AAAs that had volunteered to participate in August. And the next steps now are us kind of finalizing the model and basically drafting a program instruction to send out to the AAAs and instructing them, of what they can and can't do and what they'll be required to do if they would like to offer this. I was really excited by the enthusiasm from our network. They really seemed like they were quite interested, especially when it came to offering vouchers. We did focus groups with caregivers, but now we're in a phase where NYSERC is still partnering with us, and we have a small team with our legal counsel and program. We're pulling in fiscal for some questions we have for them, but Doris and her staff member, Karen, who's overseeing the vouchers. So we're working very jointly with all of these efforts just to kind of make sure that, we're talking and working this where it really can work nicely and complement one another. So we'll keep you posted, but we're still working and we're meeting pretty much weekly, hoping to have it done by spring.
Have you cloned each of you? Because I don't know how you've gotten so much done. It's amazing.
Yeah.
I feel bad for the new intern. We're really trying to get her up to speed quick, right, Abby? I think she was on for a little bit. She had to jump off. I think she had seminar this afternoon, but yeah, it's been a lot of work. And Doris always kind of like pokes fun at me. We were able to see each other in person this week. We were very excited. We had a conference in Albany, so Doris was in town, so that was really, really nice to see her in person. But we always joke because she'll be like, okay, Dina, like not tomorrow, okay? Like I need a little bit of breathing room. I'm like, I know. Not till spring. I'm not talking about this till spring.
There's some real synergy going on, and I've just watched it develop, but I don't really know exactly how you do it. But one of the things that strikes me, everything that you're involved is really meaningful. You're not asking people to participate in anything that's too ethereal, that it's like, it's action and you have deliverables. And I don't know, you all seem really happy with each other and nice to one another. I think there's like something going on there that's really important. And then things seem to like build off one another. And I don't know if that's fortuitous or you have a really long range view, but something you're doing, we'll have to figure it out, right? Because we need to bottle you and sell you to the network. By that, what I mean is like, the greater community can, I think, benefit from what you all are accomplishing in this group. And so at some point, let's talk about how we can share the wealth of knowledge that you have and put it in a framework where people can understand years of collaborative work and and borrow from it. So I'm just sort of blown away by you guys every month. Wonderful.
Who hasn't
So,
spoken yet? Renelle? Hannah?
I'll go next.
Okay.
Yeah.
now,
So, hello, Ronelle from Oklahoma. We have a lot of collaborations and partnerships going on that I think are driving our force for sustainability. I think I had talked previously that we're working on a respite app that's going to be like on the phone, an actual app for phone. And that is actually being led by Oklahoma Human Services. They decided to take that on statewide. And so there's about 5 partners. We have about 10 different respite partners statewide. About 5 of us are coming together on this app. So it's almost your no wrong door. You come onto this app for respite, you put in your information, and you will be directed straight to the respite that you meet the criteria for. That is hitting the ground running. It's doing really well. We actually hired, I say we because I'm with Oklahoma Human Services. They hired an agency to create this app. So we've had a lot of strategic meetings of let's plan this out. What do we need? And one of the things that we found, with our lifespan that I oversee, we do the pre and post surveys. A lot of the other respite providers don't. And so they're going to be adopting that as well. So they can start collecting that data. So very good thing happening there. We will be, as a statewide coalition for Lifespan, we're going to be looking at our strategic plan again. Unfortunately, we're not going to do that until March when I'm back from maternity leave. So, but we're in talks. We're getting things planned out, getting it on everyone's calendars because we think that, in order to sustain, you need to meet and have these talks fairly often. And so it's time to have that talk to let's really create our strategic plan again and see what our state wants to really do and continue doing.
so Renelle,
Mhm.
is that an update of a previous plan, the strategic plan, or is it a new product?
It will be an update, and I'm sure there will be some new stuff thrown in there. At least in my mind, I have some new ideas. So hope they're ready for me when I come back. And on that note, I am having my baby in about 10 weeks. So I'm on that countdown.
Yeah.
Yes. The other thing, another collaboration that we were doing, and it's sustained again through Oklahoma Human Services. We've always had a senior hotline, and we have revamped it completely. It is now an 800 care and assistant helpline. And we collaborated with all of the AAAs throughout the state of Oklahoma and with Sooner Success. I know I talk about them quite often. They're the ones that really do a lot of our children. So we're meeting the needs across the lifespan. It's again one of those no wrong doors. A family can call this helpline. There's prompts that are very, very strategically put in place. And when they click that prompt, it's going to go to a live person to answer and help that family find the resource that they're needing, including, of course, respite. Another thing that I'm excited about, and that is our sustainability, is our SIV shops. We actually have partnered with, I say we, Sooner Success has partnered with the State Department of Health, and we will be expanding SIV shops. They're going to be hiring a full-time person to take on that job. We're also going to be bringing in from out of state a first generation trainer of SIV shops, and to do a training to train up new first generation people so that we can get that going. And we hope to saturate. We have few SIV shops throughout the state. We hope to really just saturate it, and that's the hope of that partnership. And with that partnership too, they decided, depending on how COVID goes, next year they're going to be doing their first ever SIV shop camp. And in that camp, they're also going to, there's lots of work going into place. Looking at June for next year of doing this. They will also be taking the children that have special needs or disability. If they want to attend, there will be a camp for them during this time frame as well. And then they're also looking at doing a SIP Shop Parent Summit where we put the parents somewhere and just give them that, twofold respite again on this whole idea of SIP Shop. So we're excited about our partnerships. I think those partnerships are what's going to be our driving force for sustainability. The more partners we can get in, the more we can make things happen. So that's all I got right now.
That's a good report. That's a lot for when you're pregnant too.
Oh, I'm tired.
I bet you are. So let me just ask you, you mentioned doing pre-post surveys, and then you said other programs are adopting this. Did you inspire some evaluation?
I guess we did. And then we also, yes, we must have, because, one, we have to keep it on. And we had to let I guess their data group, I don't know, the people that create the app, I don't know what they're called. We had to let them know we need this. And when everyone else saw that, they're like, wow, that would help with our numbers too. And what is meaningful in that we're doing with our respite. And we're like, you're welcome. So
that's fantastic. And let me ask you too, I just noticed this sometimes when I write up reports for Arch, I'll go to the different websites, and yours works beautifully. Not all of them worked beautifully. So how did you get to the point where and how will you get to the point where like the senior hotline? And I love that you're connecting with a real person. I think that's so important. How are you going to tell whether or not that works for caregivers?
On the helpline part?
Yeah, just for example.
So every one of those, so the AAA staff, the senior success staff, all of them, they do have, it's not necessarily a referral form, but I guess that'd be kind of the best way to state that at this moment. They're going to be collecting that data. So we are collecting data off of those phone calls. And that's another brilliant thing. I'm glad you just made my brain go, oh yeah. That's another thing with that helpline. We literally put in every single zip code in the state of Oklahoma. So when someone calls, you're entering your zip code. And then you're being directed to a worker that is within that zip code. So we're capturing where these families are at. And I think that'll also help us to see where there's gaps in service.
Yeah, that's fantastic. And so, yeah, that's really amazing. And so the caregiver who's already stressed is not going through 10 steps and you don't lose them along the way.
Correct. And it's a one-stop shop. And if for some reason they do click the wrong prompt, our two teams, our AAA staff and the Senior Success staff, we had a soft handoff meeting introducing every single one of them to each other, and it went very well. And so they know who is in what counties and things of that sort. And so if they do, say by chance, AAA gets a phone call and it's really for children, they know exactly what county coordinator for Senior Success to call and say, hey, here's this person, I'm sending them to you.
Okay, so this is so great for sustainability because you're troubleshooting up front.
Yes.
And not letting it bomb, that because if it bombs, it's not going to be sustainable, right? That's
correct.
That's fantastic. Yeah. Yes. Way to go, pregnant lady.
We're excited, and it has launched. So we thought it took some time, and we thought it was going to take longer. And we were like, we have got to get this going now. And it's live, it's active, and they're already getting phone calls. So we're excited about it.
Oh, that's fantastic.
Thank you.
So I'm not sure everybody who's presented, but I don't think we've heard from Brooke, have we?
Yeah, she did tell us about her training work at the start.
That was when I was. How about Hannah? You're new to the group, but do you feel like jumping in?
I can, yes. So I'm Hannah. I'm from Nebraska. I work with the Department of Health and Human Services. I started my position as the program coordinator in the end of July. So I haven't had a lot of time, but a few things that I can touch on for our program is that I may be wrong on dates, but I believe in December of 2019, they started to update the state regulations pertaining to lifespan respite for the state of Nebraska and making revisions to those and condensing it down. It's currently in 3 chapters. We would like to make that a little easier to read and follow. That is in the final approval stages with our governor. So I'm excited about that because now it will be in the regulations that providers have to be network screened, which means they have to complete training, orientation, and a background check. Currently in the state of Nebraska, you do not have to have a background check completed to be a provider. So we saw the need to ensure that we were providing safety for vulnerable populations and getting that in place. So that is exciting. Additionally, we are working on putting out our Lifespan Respite funding announcement. What that is for it's competitive, applicants can apply. That will go live for the state of Nebraska on the 1st of October. And I have been assisting with getting that through the approval stages, and then also working on the vendor list to make sure that that's routed out to the nonprofits and community organizations for them to be able to apply. We currently have 6 areas in the state that have a respite coordinator in each area. And so we work collaboratively together. And then additionally, they work with the clients in their area. I guess another thing that I'm personally doing is going through utilizing our database that tracks our billing for respite and the clients that we support, and reaching out to those that have possibly received a denial notice due to maybe failure to provide information, and just touching base with them to see what barriers they're having. And this morning before this meeting, I was working on reaching out to clients that have not been billing in the past 90 days and discussing with them. And I'm sure that everybody has encountered the same, but the barrier there continues to be finding providers in their areas, finding providers that they trust with their loved ones, including those that have increased medical need or behavioral issues. So, but yeah, other than that, I'm just trying to familiarize myself with everything and get more knowledge. I have an extensive background in DD. I've worked for an agency that supported individuals with DD for the last 13 years. So this is kind of new, but similar. And yeah, it's been very exciting, and everybody has been so welcoming that I have spoke to. And
Yeah. I worked in DD for like all my life, and I'm a sibling of a brother with a disability, but respite is the most welcoming, nurturing group of like, it's just the best. So I'm so glad you're part of it. And I have to say, it sounds like you really hit the road running.
I have.
One of the things that I wanted to comment on, when you talked about your Lifespan Respite funding announcement, was it discretionary funds for smaller projects around your state, I think?
Yes, it's legislative funds that are allotted to the Lifespan Respite Network. Yes.
And so one of your funded programs in 2019 was one of our recipient of innovative and exemplary practice recognition, and was also one of my favorite programs. And one of my other favorite programs is New York, for the Innovative and Exemplary program this year, that was funded by their mini grants.
Susan, I think you're getting a little confused with who they funded. She's talking about the regional offices of their state Lifespan Respite network,
right?
Not individual respite providers services.
Because the one in Nebraska was funded somehow. I don't know the funding system in Nebraska obviously well enough, but yeah, I know about the regions. But do you support like individual programs or just regions?
We just do the regions. So it's in two separate
it would have
sections.
been funded by the region. Okay.
Yes. So the funding announcement is for the regions, for the coordinators. Typically those in the past have been like state health departments. And so that's like a subsidiary of them. And then additionally, we have just the Lifespan Respite subsidy, which is a larger chunk of legislative funds that go towards the payments of respite to the families. And that includes, in the state of Nebraska, it's $125 a month, and then you can apply for what is called exceptional need. And that funding can get you up to an additional $1,000 a month. So we have two, and I oversee both of those, as well as the DPFS program with the state of Nebraska. So that's the Disabled Persons and Family Supports.
Okay, so I was confused. I know that the program that I'm talking about, Sharon
Yes.
Johnson, when she was still there, knew about it through one of the regions. So I'm not sure how the funding came, but anyway, there was a connection somehow between those wonderful model. It can be a connection between those wonderful model programs and the larger system. And I think they're so important because those small programs really inform us about what we can do with sometimes small bits of money that have huge impact. And so I wanted to just shout out to Nebraska. The other thing that I wanted to comment about that Hannah was talking about was she's reviewing the database, identifying barriers to respite. And she's able to do that because Nebraska has this incredible, strong statewide database, which I think is so important for sustainability because it allows you to know where you are at any given moment. Oklahoma just gave us another strong example like that. And you can't really advocate for these programs effectively unless you can show their strength. Idaho's another great example of that. So we're so glad you're part of the group. So
I'm
welcome.
excited. Thank you.
Yeah, thank you. So, Andy, oh, did we hear from Yuta?
No.
Yuta, are you still on?
I'm here. Yes, I'm here.
Hi.
Yeah, so in Arizona, we have been trying to plan for a more formal, I guess the general term is a respite coalition. We're going to call it the Arizona Respite Network. We have our first big quarterly meeting planned for October 19th. We've had sort of small groups and subcommittees working for the last year and a half. And we now want to sort of take the big step forward. And so we have sort of three components of that. I, at the Caregiver Coalition, am trying to invite other coalitions and nonprofits. And then Lita Nelson at the state, in the State Unit of Aging, she has received permission from her leadership to formally invite all the other state agencies. So that includes, DDD. I mean, informally, we've been working with them all this time, but for a more formal collaboration. So DDD, Health Services, Adult Protective Services, the VA. I think that's kind of where we're at right now. I think they're still trying to figure out how to approach our Medicaid organization because it's such a big, huge entity all on its own. And then our third component is somebody from an area agency on aging is contacting all the providers that work with all our area agencies on aging. First of all, to invite them to participate, but then the next step is also to create, again, a more formal list of providers with criteria still to be finalized. But we plan to publish that list because so far, at least at our coalition, when caregivers call us, we tend to say we cannot recommend anybody just because we don't have a process. But we hope to, compile this list so we can direct families to that list, and a subset of that list is supposed to become a list of providers that provide overnight and emergency respite. So we have, we're developing a bit of a focus on emergency respite. Then the other thing that I've just been really busy on, so my apologies for disappearing, is so we just received an AmeriCorps grant. And so we've been building our own helpline, and we've really been growing beyond our capabilities. And so we're going to try the AmeriCorps approach. The climate for recruiting members is still very, very challenging. We hear that from a lot of people, but we're hoping, AmeriCorps is basically volunteering or, doing service with a stipend. So we're hoping to be able to use that to, have more AmeriCorps members to help us staff our helpline. But also, so far we have two partners. One is an area agency. One is the Center of Excellence for Disabilities at the University of Arizona. And I'm talking to a couple of other organizations. that they will take some of our AmeriCorps SWATs basically in their organizations and do very similar caregiver support work, meaning providing information, resources, possibly some friendly visiting. And then as part of this, what we're trying to do, you know, it's a lot of, no, not a lot, some of our resource providing is often very brief, right? Well, okay, here's the number to DDD, you know, ask them about this, good luck, kind of, you know, and I'm simplifying. We're a little better than that. But what I'm hoping to get to is that almost more a step towards options counseling, and a little more tailored help. So instead of telling somebody, hey, you know, there's 10 support groups in Scottsdale, here's some phone numbers, you know, we're going to try, oh, so you're in Scottsdale and this is what your situation is. Let me try to help you find a support group for you, right? That kind of thing. So that's the other big effort we're getting into. And then the last thing, we're just starting on, and we're still trying to even find our way. So we're part of a cohort with the what's NIC, the National Alliance on Caregiving, right? And so we want to propose to create a whole big effort around creating a state plan on caregiving. And so we're still pretty much internal to the Caregiver Coalition. We've approached the State Unit on Aging. The initial response was mixed, right? I guess they were not totally happy, but I think they're coming around. So we're going to pursue that, you know, and then of course we'll have to start thinking, how do all these pieces, you know, how will they relate so that we don't have parallel efforts going on. So that's kind of where we're at.
So, Yuta, welcome back. We've missed you. And I just have to say, so Yuta inherited a situation several years ago where there was a big change in leadership in the state without a real clear succession plan. And so I'm shouting out to you that you're just like the tenacity, the growth of your vision is just amazing. Listening today to hear all you've accomplished. And so like the large group meeting in October 19th with these 3 different strong partners, just wonderful. You talked about university partners to get the AmeriCorps, to strengthen the AmeriCorps effort, like another thing that's just been shown to be really, really important in sustainability work. I love the move towards option counseling because Arizona was more sort of day programs. And so you've really broadened and really are looking at lifespan. So I'm just astounded. And you're a really good example of like, you can't start from zero and do sustainability planning, that you have to strengthen all these other things. And now you're thinking with the strategic or the state plan on caregiving, like how to make them all make sense together. I'm just really impressed in the direction that you're moving. It's like, that's wonderful. So good on you. You are tenacious, aren't you?
I would also suggest
relationship building.
Yeah.
Yes.
I wanted to quickly, we're all running out of time, but I wanted to suggest to you, Yuta, that maybe you talk to Marilyn in Idaho and Dina in New York about using the TCare assessment tool, because that's an evidence-based caregiver assessment tool that really helps you identify what the real needs of the caregivers are and how to help them access those services. I think it's a little pricey.
It is.
But you might just want to investigate how they have used that tool.
Okay.
And then report back about how, you know, if you're going to use it and how useful it is. So.
At some point, I would love to hear from those of you who use TCare. Once you've done this thorough assessment of caregivers, how successful are you in helping them access the services that they identify they need? Do you follow them out that far?
Yes, we do. It's a warm handoff, but we're trying to make sure that the information we have in our database, that our navigators kind of know who's where, and what they do. And so when the assessment is done and that dashboard pops up that this person could really benefit from some counseling, then we know counselors that are in a particular area that we can plug them into.
Yeah, that's
But I'll tell you,
wonderful.
the most useful thing is giving them an ear. Is really the assessment process is kind of lengthy, but it's a wonderful listening opportunity for caregivers who often have never had anybody ask about them. And you're right, it is pricey.
So
And
how
we-
pricey is it?
We launched in May, so we haven't had as much time under our belt as Marilyn as far as following the caregiver. That was one of the things, though, that I was attracted to, because I feel like it provides that touch base, you know, every 3 months to kind of, I mean, it's a journey, right? And it ebbs and flows.
Exactly.
You really need to be connected and build a rapport with the caregiver to, like, you know, make adjustments as they go along, right, in that care plan. And maybe what was going to work 3 months ago isn't going to work anymore. So
Exactly.
yeah, so I mean, from that perspective, and not that I've had firsthand experience in working with the caregiver with the tool, but I did take the training, and we've been holding monthly user group calls to get that qualitative feedback from all of the T-Care specialists. We have 25 users using the tool, I think from 12, 15 different organizations. And we have some barriers for sure, the resource directory being one of them, because we have a very robust resource directory with New York Connect. So we were not able to use their software-based resource directory. We didn't want to duplicate what we already had. So for the pilot, we did a workaround, but we're coming back to that now because our contract's up at the end of the year. We need to make a decision about, you know, are we going to expand? You know, what are we going to do? But right now, there's not even enough data for us to feel confident in kind of making any recommendation, you know, to our director. So, but we also have another whole pilot project that's underway, and I know we're at time, but I wanted to ask a question, and we can maybe talk about this next time. But is anyone working with archangels? They did a phenomenal presentation at our conference this week, but it's a caregiver intensity index. So there's like a little questionnaire that caregivers complete, but it sounds like we have a very small technical assistance grant with NASHB. I think we got $40,000 for 1 year, and we had built T-Care into the proposal, but our director is envisioning something bigger, and we don't know a lot of details, but it involves Caring Wire, Archangels, and T-Care. And the three of them are working together to create develop some product that I think we're going to be testing. But if you haven't heard of Archangels, I thought the woman did a phenomenal job in her presentation, and the tool looked really cool. So check it out. I was just curious what other people thought of it. But we're happy to report more on T-Care, though, as we're learning more. Like I said, we're meeting with them monthly, but I feel like we've only been, you know, using it since May.
There's so much wonderful data about T-Care out there already, especially from Washington State, which demonstrated cost benefits. And they've been using it for, I don't know, decades. Long time, maybe not decades, but a long time.
Yeah, she said, I think when we talked to Dana, I think she said it was 2008. It was
Yeah, they started a long time ago. Yeah.
We also talked to T-Care about setting up a users group so that Dina and I and Dana don't have to kind of do it individually, that T-Care should be maintaining a users group for those of us who are doing it.
Oh, I'm surprised they don't have one.
I know.
Talk to Rhonda about that.
Well, we did talk to Linda Miller at T-Care about it.
But Susan, to answer your question, we were able to get in just in the nick of time last year to keep the $2,000 per user price.
Mm-hmm.
I'm sure it changes depending upon how many users you have. That was for 25. But they did tell us they were increasing the cost to $2,800 per user.
Right.
I mean, that's beyond the cost of most of our grantees, I think. Way
And
beyond.
they were, I think they waived it for us, but they also had a $10,000 like implementation fee too.
Yeah, they waived that for us too, and we got in at the $2,000 level, but we've been told it's gonna go up, and we've got, I think, four licenses.
We are requiring under our Lifespan Respite grant, the new one, the Caregiver Wellness and Respite Center that will start next July. I'm not sure how many they're going to, because they cover 6 counties. So we're waiting for them to kind of share with us how many they'd like to have trained. But we are going to require that they use the T-Care assessment tool because we really do think it's going to provide really great data. They have a lot of clinical outcome measures. So
I just wanted to mention though, it's not a front-facing database.
right.
So it's something that you punch in the assessment information and it generates goals and resources from the database that you could use to refer people to.
But if the resources aren't in there, like we didn't have them build the resources, they have to manually input it in the first instance, and then it'll be available for all our users because we really wanted them to keep using their New York Connects resource directory. And we figured if we end up expanding or having this like be our tool, then we'll figure out a way that they can access New York Connects from within T-Care, because we scraped databases.
We scraped 211 and other resource databases, or T-Care did, and dumped it in, and then we're adding all the time.
I mean, I think that's really key to the successful caregiver assessment. Again, it's like giving people money to buy bread and they go to a grocery store and there's no bread on the shelves. I mean, right. You can assess caregivers for all of these services and then, oh, well, you need respite, but sorry, there isn't any.
And Jill, really I just want to, Susan, I just want to mention, we've been really rigorous the last few months in working, trying to reach Spanish-speaking families. And what we're finding is we do these assessments and we get them teed up and there aren't Spanish-speaking services to refer them to. Maddening. So that's a whole other issue.
It can just lead to a whole new level of frustration. Yep. I know I really need these services and I can't get them.
Yeah. I'd love to use one of our sessions just to go deeper in this, maybe a few months from now, and make sure Washington's on the call too, to talk about what this is and how it's working and how you're using data. This is so relevant to sustainability and so important.
Oklahoma would appreciate that.
T-Care is used by the Medicaid program in Washington, isn't it? It's huge there. I mean, it's totally state funded.
Okay.
Yes.
Okay, I'm leaving inspired again by all of you. And so for now, how many more calls do you think you'll be on? You've got 10 weeks to go. Well, we'll see, huh?
Yeah. But we meet monthly, right?
Monthly. So we'll see you
2 more.
October.
Yeah, you'll see me 2 more times.
Okay. Yay.
Yeah, 2 more.
Okay.
And Susan, I'm sorry you didn't get to finish your slides because they were beautiful. So I'm just going to show them.
Oh, okay. Yeah, we almost got through. And one of the things, I don't know if you noticed this, but the slide on systems, as you all presented, you could just check off all those columns over and over, and the use of data to support your work. It's really strong in this group. I mean, you're all doing really well about that. We haven't gone into advocacy. We'll talk more about that after New York does their October 8th last summit meeting, because I think that's going to come up. But yeah, I'd love to talk more about advocacy and sustainability. And Jill is a fan of Partners in Policy Making, and we had a Partners in Policy Making grant at University of Washington for persons with developmental disabilities. And Jill, I found they have online training now, I think at no cost. So that might be worth looking at.
Really? Yeah, I need to find out.
Yeah, I'm gonna check it out a little bit more before I bring it to the group. And then that last slide, this learning community, because I think this has so much to do with what we're doing as a group in this Sustainability Learning Collaborative, but what I see you all doing in your states, that's so important. clarifying ideas, identifying tools for change, engaging in applied projects, sharing your knowledge base, and building systems within and in your own communities. You're already doing this. So this book that I'm reading is just to kind of reinforce what you're doing and to make it understandable as new people join the group and as we share with the greater group. And you're wonderful. And the other thing that I'd like before we go is to remind you that there's the performance measurement group is meeting on September 30th. And that, I think Ray Kirk, who's a researcher evaluator extraordinaire, is speaking this next meeting. And the performance measurement's really important too. You know, I'm preaching to the choir here. You guys already get it, but I know Maryland, you go, I'm not sure if New York goes, but I recommend it to you, and you'd be great additions to that group and really helpful to yourself and to others. So that's my shout out for the performance measurement group. And thank you all. You're wonderful.
Thank you.
Thank you. Have a great weekend.
Yes, thank you. Have a great weekend.
Thank you.
Bye, ladies.
Take care, everyone.
You too.